Now, when we do look ahead to after you've had your surgery, this might be for you a couple of weeks ago. It might be tomorrow you'll have had the surgery. It might be that you actually had surgery maybe 6, 12 months ago and you're thinking, God, this isn't really worked. I'm still back at square one. What should I be doing? This section is really for you. The biggest thing you can do here is continue to do what you did in the prehab. And if you didn't do the prehab section, then you start it now. It starts wherever you start. Learn spinal control. Learn to do those simple exercises like the dead bug and the marching bridge to be able to actually control this column effectively. Maybe we've had that bit of disc cut out. It's gone now. Maybe we've had a laminectomy. Maybe we've had something else, right? Some bone shaved off, whatever it may be. But now learn to control that spine. Learn movements like the squat and the hip hinge. Practice them not only in your exercises, but practice them when you're moving around the house on a daily basis. Lean on tools like the tape test to help you start to retain or regain the understanding up here of what the spine is doing down here when you move around the house. And ultimately, you should start to create a plan or a strategy to reintroduce significant amounts of load back into that spine, because that is what will rebuild strength and stability in that spine. We talk with members and patients about a goal of getting somewhere in the region of 50, 75, or even 100% of your body weight being able to do on things like the squat or the hip hinge. And that might sound completely unattainable for you, but it's worthwhile aiming at over the course of the next couple of months and years. You might not get there for years, but if you're working on increasing that, that is going to be helpful. Because the simple fact of the matter, as we've discussed many a time before, is life has load. You're going to have to pick things up. You're going to have to pick things that weigh things up. And strength is never a weakness, and being weak is never going to be to your advantage. So the only thing that is left for you to do is steadily make that change.